I want you to go, members, and read about the femoral triangle and understand it. Go and read about the femoral triangle. It's very important for you to appreciate. Now, there's a triangular region on the anterior aspect of the thigh, anteromedial aspect of the thigh. There's a triangular region. This triangular region is clinically important. How? Deep within this triangle, we have the femoral vein, the femoral artery, and the femoral nerve. The femoral vein draining deoxygenated blood from the lower limb, the femoral artery supplying oxygenated blood to the lower limb, and the femoral nerve supplying muscle of the anterior compartment. We also have lymphatics draining the lower limb. So deep to this femoral triangle, we have the lymphatics which drain lymphatic fluid from the lower limb. We have the femoral vein which drains the oxygenated blood from the lower limb. We have the femoral artery which supplies blood to the lower limb. And we have the femoral nerve which supplies the muscle of the anterior compartment of the thigh. Now, what makes it of clinical significance? Those contents which are located within it are only covered by skin and subcutaneous connective tissue. They are very, very important structures, but they are covered by skin and subcutaneous tissue. So they can easily be injured. On the other hand, they can be used for laboratory, for clinical procedures, not laboratory. They can be accessed and used for clinical procedures because they are near to skin. But on the other hand, because they are near to skin, they can easily be injured. So that is why this femoral triangle is of clinical significance. Any penetrating injury on the anteromedial aspect of the thigh can either injure the femoral artery, the femoral vein, and the femoral nerve, because they are only covered by skin. So this femoral triangle has a superior border, which is made by the inguinal ligament. This is the inguinal ligament. It forms the superior border of the femoral triangle. This is the medial border. This medial border is formed by a muscle known as adductor longus. It's a muscle of the medial compartment of the thigh. And this lateral border is made by the muscle known as the sartorius, which we have talked about as a muscle of the anterior compartment of the thigh. So you can see the inguinal ligament forming the superior border. This muscle adductor longus forming the medial border. And this muscle sartorius forming the lateral border of the femoral triangle. The roof, skin, and subcutaneous fascia. The floor, are you seeing the floor of this triangle? The floor is made up of this muscle iliopsoas and pectineus. These are the muscles which form the floor of the femoral triangle. And these are the muscles which form the boundaries plus the inguinal ligament. And what forms the roof? What forms the roof of this femoral triangle?
The skin and the subcutaneous fat.
The contents from medial to lateral. This is the femoral canal. What is the importance of the femoral canal? It is an opening through which lymphatics of the lower limb pass as they are draining the lower limb. Lymphatic drainage from the lower limb is taken by these lymphatic vessels which pass through that femoral canal to the abdomen and the pelvis. So the most medial part component of the femoral triangle is the femoral canal, which conducts lymphatics. From the femoral canal, we go to the femoral vein. From the femoral vein, we go to the femoral artery. From the femoral artery, we go to the femoral nerve. Those are the contents of the femoral triangle from medial to lateral. You can also mention them from lateral to medial, as long as they are in order. And the femoral vein and femoral artery They are surrounded by a connective tissue known as the femoral sheath. Femoral sheath. So this is the femoral triangle. They can insert a catheter within the femoral artery and navigate it up to the arch of the aorta and inject contrast in the coronary arteries to outline them when they are making an X-ray of the chest. They can tap blood from the femoral vein for laboratory investigations, or they can insert lines there. Intestines, loops of intestines can herniate through the femoral canal and form a femoral hernia, which hernia can compress these blood vessels and compromise blood supply and venous drainage to and from the lower limb. So I've indicated you some of the clinical significances of the femoral triangle. You'll go and read about them. The femoral pulse means when I palpate the femoral triangle, palpating is to compress or to touch the roof. When you press the roof of the femoral triangle, you sense the pulsations of this femoral artery. And when you sense the femoral artery pulsating, it means that blood is reaching the lower limb. But if the femoral artery is not pulsating, it means that blood is not reaching the lower limb.